What Soviet Medicine Teaches Us by Yuri N. Maltsev, an audio Mises Daily narrated by Harold L. Fritchie. In 1918, the Soviet Union became the first country to promise universal cradle-to-grave health care coverage to be accomplished through the complete socialization of medicine. The right to health became a constitutional right of Soviet citizens. The proclaimed advantages of this system were that it would reduce cost and eliminate the waste that stemmed from unnecessary duplication and parallelism, that is, competition. These goals were similar to the ones declared by Mr. Obama and Ms. Pelosi, attractive and humane goals of universal coverage and low cost. What's not to like? The system had many decades to work, but widespread apathy and low quality of work paralyzed the healthcare system. In the depths of the socialist experiment, healthcare institutions in Russia were at least 100 years behind the average U.S. level. Moreover, the filth, odors, cats roaming the halls, drunken medical personnel, and absence of soap and cleaning supplies added to an overall impression of hopelessness and frustration that paralyzed the system. According to official Russian estimates, 78% of all AIDS victims in Russia contracted the virus through dirty needles or HIV-tainted blood in the state-run hospitals. Irresponsibility, expressed by the popular Russian saying, "They pretend they're paying us, we pretend we are working," resulted in appalling quality of service, widespread corruption, and extensive loss of life. My friend, a famous neurosurgeon in today's Russia, received a monthly salary of 150 rubles. 1/3 of the average bus driver's salary. In order to receive minimal attention by doctors and nursing personnel, patients had to pay bribes. I even witnessed the case of a non-paying patient who died trying to reach a lavatory at the end of the long corridor after brain surgery. Anesthesia was usually not available for abortions or minor ear, nose, throat, and skin surgeries. This was used as a means of extortion by unscrupulous medical bureaucrats. To improve the statistics concerning the number of people dying within the system, patients were routinely shoved out the door before taking their last breath. Being a people's deputy in the Moscow region from 1987 to 1989, I received many complaints about criminal negligence, bribes taken by medical apparatchiks, drunken ambulance crews, and food poisoning in hospitals and child care facilities. I recall the case of a 14-year-old girl from my district who died of acute nephritis in a Moscow hospital. She died because a doctor decided that it was better to save precious X-ray film, imported by the Soviets for hard currency, instead of double-checking his diagnosis. These X-rays would have disproven his diagnosis of neuropathic pain. Instead, the doctor treated the teenager with a heat compress, which killed her almost instantly. There was no legal remedy for the girl's parents and grandparents. By definition, a single-payer system cannot allow any such remedy. The girl's grandparents could not cope with this loss, and they both died within 6 months. The doctor received no official reprimand. Not surprisingly, government bureaucrats and Communist Party officials as early as 1921, 3 years after Lenin's socialization of medicine, realized that the egalitarian system of health care was good only for their personal interests as providers, managers, and rationers, but not as private users of the system. So, as in all countries with socialized medicine, a two-tier system was created, one for the gray masses and the other with a completely different level of service for the bureaucrats and their intellectual servants. In the USSR, it was often the case that while workers and peasants were dying in the state hospitals, the medicine and equipment that could save their lives was sitting unused in the nomenklatura system. At the end of the socialist experiment, the official infant mortality rate in Russia was more than 2.5 times as high as in the United States, and more than 5 times that of Japan. The rate of 24.5 deaths per 1,000 live births was questioned recently by several deputies to the Russian parliament who claimed that it is 7 times higher than in the United States. This would make the Russian death rate 55 compared to the U.S. rate of 8.1 per 1,000 live births. Having said that, I should make it clear that the United States has one of the highest rates of the industrialized world only because it counts all dead infants, including premature babies, which is where most of the fatalities occur. Most countries do not count premature infant deaths. Some don't count any deaths that occur in the first 72 hours. Some countries don't even count any deaths from the first 2 weeks of life. In Cuba, which boasts a very low infant mortality rate, infants are only registered when they are several months old, thereby leaving out of the official statistics all infant deaths that take place within the first several months of life. In the rural regions of Karakapakia, Sakha, Chechnya, Kalmykia, and Ingushetia, the infant mortality rate is close to 100 per 1,000 births, putting these regions in the same category as Angola, Chad, and Bangladesh. Tens of thousands of infants fall victim to influenza every year, and the proportion of children dying from pneumonia and tuberculosis is on the increase. Rickets, caused by a lack of vitamin D and unknown in the rest of the modern world, is killing many young people. Uterine damage is widespread thanks to the 7.3 abortions the average Russian woman undergoes during childbearing years. Keeping in mind that many women avoid abortions altogether, the 7.3 average means that many women have a dozen or more abortions in their lifetime. Even today, according to the State Statistics Committee, the average life expectancy for Russian men is less than 59 years, 58 years, 11 months, while that for Russian women is 72 years. The combined figure is 65 years and 3 months. By comparison, the average lifespan for men in the United States is 73 years and for women 79 years. In the United States, life expectancy at birth for the total population has reached an all-time American high of 77.5 years, up from 49.2 years just a century ago. The Russian life expectancy at birth is 12 years lower. After 70 years of socialism, 57% of all Russian hospitals did not have running hot water, and 36% of hospitals located in rural areas of Russia did not have water or sewage at all. Isn't it amazing that socialist governments, while developing space exploration and sophisticated weapons, would completely ignore the basic human needs of its citizens? The appalling quality of service is not simply characteristic of barbarous Russia and other Eastern European nations. It is a direct result of the government monopoly on health care, and it can happen in any country. In civilized England, for example, the waiting list for surgeries is nearly 800,000 out of a population of 55 million. State-of-the-art equipment is non-existent in most British hospitals. In England, only 10% of the health care spending is derived from private sources. Britain pioneered in developing kidney dialysis technology, and yet the country has one of the lowest dialysis rates in the world. The Brookings Institution, hardly a supporter of free markets, found that every year 7,000 Britons in need of hip replacements, between 4,000 and 20,000 in need of coronary bypass surgery, and some 10,000 to 15,000 in need of cancer chemotherapy are denied medical attention in Britain. Age discrimination is particularly apparent in all government-run or heavily regulated systems of health care. In Russia, patients over 60 are considered worthless parasites, and those over 70 are often denied even elementary forms of health care. In the United Kingdom, in the treatment of chronic kidney failure, those who are 55 years old are refused treatment at 35% of dialysis centers. 45% of 65-year-old patients at the centers are denied treatment, while patients 75 or older rarely receive any medical attention at these centers. In Canada, the population is divided into 3 age groups in terms of their access to health care: those below 45, those 45 to 65, and those over 65. Needless to say, the first group, which could be called the active taxpayers, enjoys priority treatment. Advocates of socialized medicine in the United States use Soviet propaganda tactics to achieve their goals. Michael Moore is one of the most prominent and effective socialist propagandists in America. In his movie, Sicko, he unfairly and unfavorably compares health care for older patients in the United States with complex and incurable disease to health care in France and Canada for young women having routine births. Had he done the reverse, that is, compared health care for young women in the United States having babies to older patients with complex and incurable diseases in socialized health care systems, the movie would have been the same, except that the U.S. healthcare system would look ideal, and the United Kingdom, Canada, and France would look barbaric. Now, we in the United States are being prepared for discrimination in treatment of the elderly when it comes to health care. Ezekiel Emanuel is director of the Clinical Bioethics Department at the U.S. National Institutes of Health and an architect of Obama's health care reform plan. He is also the brother of Rahm Emanuel, Obama's White House Chief of Staff. Foster Fries reported that Ezekiel Emanuel has written that health care services should not be guaranteed to individuals who are irreversibly prevented from being or becoming participating citizens. An obvious example is not guaranteeing health services to patients with dementia. An equally troubling article, co-authored by Emanuel, appears in the medical journal The Lancet in January 2009. The authors write that, unlike allocation of health care by sex or race, allocation by age is not invidious discrimination. Every person lives through different life stages rather than being a single age. Even if 25-year-olds receive priority over 65-year-olds, everyone who is 65 years now was previously 25 years. Treating 65-year-olds differently because of stereotypes or falsehoods would be ageist. Treating them differently because they have already had more life years is not. Socialized medicine will create massive government bureaucracies similar to our unified school districts, impose costly job-destroying mandates on employers to provide the coverage, and impose price controls that will inevitably lead to shortages and poor quality of service. It will also lead to non-price rationing, that is, rationing based on political considerations, corruptions, and nepotism of health care by government bureaucrats. Real savings in a socialized health care system could be achieved only by squeezing providers and denying care. There is no other way to save. The same arguments were used to defend the cotton farming in the South prior to the Civil War. Slavery certainly reduced costs of labor, eliminated the waste of bargaining for wages, and avoided unnecessary duplication and parallelism. In supporting the call for socialized medicine, American healthcare professionals are like sheep demanding the wolf. They do not understand that the high cost of medical care in the United States is partially based on the fact that American healthcare professionals have the highest level of remuneration in the world. Another source of the high cost of our health care is existing government regulations on the industry, regulations that prevent competition from lowering the cost. Existing rules such as certificates of need, licensing, and other restrictions on the availability of health care services prevent competition and therefore result in higher prices and fewer services. Socialized medical systems have not served to raise general health or living standards anywhere. In fact, both analytical reasoning and empirical evidence point to the opposite conclusion. But the dismal failure of socialized medicine to raise people's health and longevity has not affected its appeal for politicians, administrators, and their intellectual servants in search of absolute power and total control. Most countries enslaved by the Soviet Empire moved out of a fully socialized system through privatization and ensuring competition in the healthcare system. Others, including many European social democracies, intend to privatize the healthcare system in the long run and decentralize the medical control. The private ownership of hospitals and other units is seen as a critical determining factor of the new, more efficient, and humane system. The Ludwig von Mises Institute hopes you have enjoyed this audio Mises Daily. For a world of free market literature, media, and discussion, visit Mises.org.